Your child's sun safety is being debated in classrooms and on social media, and the stakes couldn't be higher. This is GBH's Morning Edition, where we regularly connect with Massachusetts' leading public health authority, Dr. Robbie Goldstein. Today's urgent topic: sunscreen myths, legislative battles, and the vimal claims muddying the waters of sun protection. On Beacon Hill, lawmakers are considering a bill to let students and campers apply sunscreen without a doctor's note, a freedom 29 states already grant. Meanwhile, a growing anti-sunscreen movement floods platforms with questionable advice. Let's separate fact from fear-mongering. Mark Hers, Dr. Goldstein, let's start with the policy debate. Why are schools treating sunscreen like prescription medication? Dr. Goldstein, sunscreen's classified as an over-the-counter drug under current regulations, meaning schools must treat it like any medication, requiring parental consent, nurse oversight, and allergy checks. These rules exist to protect kids, but here's the contradiction. While safeguards matter, they shouldn't block access to a proven cancer prevention tool. Skin cancer remains the 5th most common cancer in the U.S., and sunscreen is our frontline defense. The goal isn't bureaucracy. It's ensuring every child can safely use sunscreen without unnecessary barriers. Hers, now let's confront the social media storm. One viral claim insists sunscreen chemicals seep into blood at dangerous levels. Cue influencer clip. One sunscreen application spikes oxybenzone 180 times above FDA limits. How do you respond? Dr. Goldstein, first, context matters. Many studies cited online use extreme conditions, lab tests on rats or humans applying unrealistic amounts. But here's where it gets controversial. While trace chemicals might enter the bloodstream, zero evidence links this to harm in real-world use. Meanwhile, we have decades of data showing sunscreen slashes skin cancer risk. Should we prioritize theoretical risks over proven benefits? I'll always bet on prevention. Hers, another trend claims you can eat your sunscreen with foods like tomatoes or carrots. Influencer clip, load up on lycopene and beta-carotene for natural protection. Is there any truth here? Dr. Goldstein, let's dismantle the natural versus chemical myth first. Water's a chemical. Cyanide, natural. Labels don't define safety. As for dietary sun protection, while antioxidants support skin health, they can't block UV rays. Imagine holding a lettuce leaf against a laser. That's the level of protection we're talking about. Sunscreen isn't optional if you value your skin. Hers, what about vitamin D? Critics argue sunscreen causes deficiencies. Dr. Goldstein, a classic half-truth. Yes, UVD rays trigger vitamin D production, but so do fortified foods, supplements, and even incidental sun exposure during daily activities. Research confirms regular sunscreen users don't have lower vitamin D levels. Would you skip seatbelts to feel the wind while driving? Protect your skin first. Hers. Final question. What sunscreen habits do you recommend? Dr. Goldstein. 3 non-negotiables. 1. Broad-spectrum coverage, UVA, UVB, SPF 30+. And 3. Reapplication every 2 hours. Pro tip. Apply a shot glass-sized amount 15 minutes before sun exposure. Most people under-apply, a mistake that's like wearing half a helmet. Hers. Dr. Goldstein, always clarifying the complex. Thank you. Now, we turn to you. Should schools prioritize sunscreen access over strict medication rules? Can natural alternatives ever replace science-backed protection? Share your views below. This debate affects us all.